It's a great profession because there's need and opportunity to provide optometric services virtually any place in the country. Our surveys indicate that the vast majority of students would prefer to be in an independent private practice as a part of their activity. The reality of their activity is that often in the initial few years they need to be in an employed situation, often transitioning over a period of years. But they're virtually 100% engaged in providing these cares. Many of them have a significant amount of debt, but I'm extremely encouraged that in the last 15 years that we have been tracking those issues at the Illinois College of Optometry, we have no defaults. It's an opportunity that's there. It's an occasion to serve patients in very important ways that optometrists do, and also make enough money that you can pay off those high student loans and have a relatively solid standard of living. Optometrists in most parts of the country were not eligible to be parts of community health centers, or if they were eligible, the reimbursement rates that were received from these federally qualified health centers were substantially below what other providers were. Those issues are changing. They're changing in Illinois, they're changing nationally in the new health system, and it is very clear that only about 5% of those community health centers really do provide any meaningful eye and vision care. And yet, the patients they serve have a lot of diabetes, hypertension, general systemic diseases which are manifest in the eye over and over and over again. So we're finding significant movement into those areas. We're finding recognitions of optometrists as physicians, and then the eligibility that comes with that for being reimbursed in the community health center for the higher encounter rate that other physicians receive.